Good evening, Bermuda. My name is Ayo Oyinloye. I'm Chief Medical Officer and a public health physician. Tonight I'll be talking to you about variants of concerns as it affects us here on this island nation. So if we move on to the first slide, um, this is actually piggybacking on what Dr. Weldon presented a few weeks ago, telling us about the various variants of concern that the world is dealing with at the moment. Our last outbreak was driven by the alpha variant, and that's the one that was originally first identified in the United Kingdom, and it is a lot more transmissible. Um, I'll be telling you a little bit more about the beta and the delta variants in a few minutes. Uh, the gamma variant is actually one that is more commonly called the P1 variant, originally diagnosed, originally first identified from Brazil, I should say. Right, so the beta variant is one that was first identified from South Africa. Uh, it actually has much more transmission than the wild type virus that we first started with. Um, the Delta variant was first diagnosed or first identified in India. It actually has much more transmissible than either the beta or the alpha or the gamma strains. So the impact of this is that much more people can get infected, much more people can get hospitalized, and much more people, unfortunately, may end up dying. So, what makes a variant a variant of concern? That is a designation given by the World Health Organization, and it's associated with the virus ability to um, the transmissibility of the virus and or the change in its way it affects people. If it also is found to be more virulent, if it causes more clinical disease, then it's tagged as a variant of concern. And finally, if we think that our public health interventions, such as available diagnosis, therapeutics, or vaccinations, are not as effective against those variants, they are tagged a variant of concern. So particularly important is the um, vaccination status and how that affects these variants. We know, as I know this has been mentioned several occasions, but I'll just repeat it. The Pfizer vaccination that we use on Ireland is actually quite effective against the Alpha variant that was the driver of our last epidemic or and the last outbreak. So that's clear. Unfortunately, the efficacy drops for all the other variants of concern. In particular, the beta variant is the one that is most successful in evading the protection offered by the vaccination. And this is why it's important to be quite careful with this variant. I hasten to add that it does not completely escape the protection offered by the vaccination. What it does actually is that the effectiveness of the vaccination in preventing infection and disease is less. So there is still some protection from being vaccinated. So if we move on to the next slide, I'm talking about the variants of interest. So I've talked about variants of concern. There are several other variants that scientists all over the world are keeping an eye on. There's the epsilon, the zeta, the eta, the theta, the iota, the kappa, and the lambda, and different names. So it's been given the Greek names so that for colloquial use and to avoid stigmatizing the areas that have actually where this was first identified. So a lot of this are things that we're keeping an eye on. And what differentiates a variant of interest from a variant of concern is it doesn't cause as much trouble as the variants of concern, the variants of interest, but they've been identified with community transmission and with outbreaks. So that's the main difference. But it does not have significant impact on our public health and social measures. So that's what accounts for the difference. So if we move on to the next slide, and talking about what this means in reality, what this means for us in protecting ourselves from this as a society, from this variant. We know that the first virus identified in the Wuhan province of China could, on the average, each person would infect between 2.4 and 2.6 other people. That's on the average. That's what we tend to find. The virus that caused the first wave of outbreaks throughout Europe actually was slightly different, and for each person on the average infects 3 different people. Our last outbreak was driven by the alpha variant, and on average each person who has an alpha variant will go on to infect between 4 and 5 people. The Delta variant is even more virulent. Each person who has a Delta variant goes ahead to infect between 5 and 8 different people. And for context, if you want to compare it with some viruses that many people might be more familiar with, mumps virus, if it infects a person, each person a mumps virus affects would infect on the average 12 people, and each person that has measles would infect 18 people. What's the importance of this? It allows us to be able to design how we manage this outbreaks when we have one. What this means is that for us to have a protected society, we can do a mathematical formula that allows us to calculate the number of people that needs to be protected before the virus gets into dead end, if it comes into the society. And that's where the concept of herd immunity comes from. So if we move on to the picture of what's happening as of today in Bermuda, you heard the minister talk about the number of active cases we have on island. We do have 15 active cases on island. Of those, 6 of those are of the Delta variant, and 5 are of the Beta variant. In 4 cases, we could not determine the variant, and that's probably because the sample quality is too poor for us to be able to get the variants out. But it's clear that we do have these variants of concern on island. There's no argument about that. It's very clear. And then, so what can we do about this? If we look at the COVID-19 symptoms, as the minister mentioned, and I will repeat for emphasis, fever or chills, cough, shortness of breath or difficulty in breathing, fatigue, muscle or body aches, new headaches, new loss of taste or smell, sore throats, congestion, runny nose, vomiting or diarrhea, or nausea are all symptoms of this. And it's important to also remember that for this variant, you tend not to have the classical symptoms of fever and loss of smell or loss of taste. So it's more, the sort of symptoms that you tend to have with it are things that you might tend to dismiss. So the key message today is not to dismiss any of these symptoms. If you do have any of these symptoms, stay away from others, get tested, and speak to your general practitioner who will be able to help you. It's not all doom and gloom. If we move on to the next slide, we're talking about some of the ways that we can protect ourselves as a society from these outbreaks. The slide I'm showing shows what is called the Swiss cheese model. It's adapted from what one researcher in Australia has postulated, and it actually illustrates very well the concept of public health and social measures in protecting a society from an outbreak like this. So what the underlying principle behind that is that there's no single measure that you can take that will protect you from 100% from the viruses or from the outbreaks. So we need to stack our measures just as you will stack Swiss cheese to prevent the viruses from affecting us as a community. So each slide has holes. Each slide is imperfect. But when you arrange them together, actually you become protected. And some of the things that we talked about, and this is not new to anybody, I'm sure most people will have heard this before, it's important to maintain your physical distance. This is an airborne infection, and if you stay 6 feet away from people, the chances that you get the viruses from them is much lower. Also, you need to wear masks. Masks prevent spilling out of respiratory droplets that can cause infections. It also protects you from inhaling respiratory droplets that can cause infections. Hand hygiene, some of the virus is carried on the hand, so that's why there's a lot less handshaking going on at the moment. That's absolutely crucial. Avoid touching your face, because inadvertently we can transfer the virus to our face and cause transfer the virus to the face and get infected from that. Also, if you're in a crowded place, limit your time. When that happens, when we find out people who have the infection, it's important for us to have a very fast and very sensitive testing and tracing system. And Bermuda is one of the world leaders in terms of testing and in terms of tracing each case that we find. So that's something we can be proud of. It's also important to stay in well-ventilated places. It's the virus loves cold, enclosed spaces where there's very little air movement. We need to stay, limit our time in closed, enclosed spaces, and as much as possible stay in well-ventilated places. It's important that people who are positive or have been exposed to positive people isolate or quarantine as is appropriate. This allows us to be able to limit the number of people that they spread this infection to. And finally, it's important that if you have the chance, get vaccinated. Vaccines are the strongest, most effective tool that we can use to protect ourselves from this virus. Thank you, Bermuda.
Thank you very much, Chief Medical Officer, for that very informative presentation. Next, to share information with the people of Bermuda will be the Minister of National Security, who will provide an update from her ministry and also updates on details regarding a supervised quarantine. Minister Renee Ming.